and me here today is Jennifer Schloss with GHT Insurance. Jennifer is an expert in all things Medicare, and Marcus and I get a lot of questions, throughout the time that we work with folks in planning for retirement and transitioning into retirement. We get a lot of questions on Medicare, and we always find it valuable to be able to have a trusted resource that we can, not only lean on for our own understanding, but also introduce to our clients for them to have a better grasp on, navigating all the ins and outs of Medicare, something that we all need to, be, ready to enroll into when we hit age 65 or retire, but not something that we all, are experts in. And so Jennifer, spends all of her time pretty much every day, I think, outside of raising her family in, helping folks to navigate the chaos that can be Medicare. So without further ado, we will pass things off to Jennifer to introduce today's topic and to walk us through Medicare 101.
Good morning, Emmett and Marcus. Thanks for having me. So yeah, we're going to go through a Medicare 101. It's just a basic understanding of the Medicare program, and it is something that I work with every single day. So I am happy to talk about it and answer questions. And there's always changing and new information. So if there is something I don't know, I am happy to find the answer. And I learn new things every day when it comes to Medicare. And I've been doing this for a long time. So I see a hand up.
Yeah, I just wanted to re-emphasize for those that are joining in. I understand a few may have called in, but if you're joining us on a device, I just want to highlight again the question and answer feature. As we go through, we will be pausing to address any questions, so please feel free to utilize that resource. I'll be keeping close eyes on some of those questions, and we'll be sure to address those as we go through the presentation. Thanks.
All right, perfect. Okay, so the agenda for today, it's not going to be too long. This won't take up too much of your time, but we're going to go over basically who's eligible for Medicare, the coverage options, when you can enroll, what the next steps are once we go through those things, and then any questions at the end. If you've saved up some questions, we can go through that, and that'll be the agenda. So the first thing is going to be who's eligible for Medicare. So you must be a U.S. citizen or a legal resident for at least 5 consecutive years and one of the following, 65 or older. So that's where everybody who's on Medicare who's over 65, not everybody, but essentially that's where you're going to see Medicare come into the discussion, is when you turn 65. You can, however, qualify for Medicare if you're under 65 with a qualifying disability, and then any person who's been diagnosed with end-stage renal disease or ALS. So you have coverage options, and this is where it can get confusing. So it's good to have an understanding of this. And if you don't clearly understand it by the end of this, you will get it eventually. It's just a lot of parts, plans, letters. So we'll touch on everything. And if you have questions, I'm happy to go over them. And if this is your first time seeing anything about parts and plans, do not feel discouraged if it feels like it's too much information at once, because sometimes it can be. But the coverage options are going to be Part A, hospital; Part B, medical; Part C would be Medicare Advantage; Part D, prescription drug coverage; and then Medicare supplements. So original Medicare, the federal program, what you've heard about your whole working life probably, that's going to be Part A, hospital, and Part B, which is medical. Part A is going to cover, it's hospital insurance. So ever since you started working, you saw a little amount probably taken out of your check that might have said Medicare when you were a teenager and you didn't know what it was. It was your hospital insurance. You've been paying into Medicare ever since you've been working. So it's basically covering inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. So the costs associated with Part A, generally, for the most part, you're going to meet people who do not pay for Part A. You typically won't, and everyone you talk to won't, because it's premium free if you've worked for 40 quarters over the course of your lifetime, or if you've been married to someone who worked those 40 quarters over the course of their lifetime. There is a deductible in 2022 for a hospital stay is $1,556. And stays of more than 60 days have some daily copays. You can utilize any hospital that accepts Medicare, and hospital care outside the US generally isn't covered. So some of these things like that deductible, that's going to be covered later on when we get over to some other parts of the coverage, but just Part A, the costs that are associated with it, premium free generally, and then the 1556 deductible in 2022. Those numbers do change every year. So Part B, this is what you are really looking at signing up for, because this is going to have a premium associated with it. Part B is medical. So that's doctors and outpatient visits, physician services, outpatient hospital services, your ambulance rides, outpatient mental health, lab services, durable medical equipment, which is wheelchairs, oxygen, knee braces, outpatient physical, occupational, and speech language therapy. And then there's some preventative care that is covered by this as well. So as far as costs go, basically with Part B, Medicare pays 80%, you are responsible for 20%. Okay. And that's where we're going to get into some other coverages a little bit further down in the slides. But as far as the 20% goes, you're responsible for 20% of all Part B approved charges, and there's no out-of-pocket maximum on that. So that restarts every year. Basically, the 20%, if you go to the doctor, Medicare pays 80%, you'll get the bill for the 20%. No max on that. It does have a monthly premium, and it is adjusted based on your income. The standard premium, where it starts at, is $170.10 per month in 2022, and that does change each year. So that information usually comes out in November as to what it's going to be for the next year. But that's the standard premium, and it does get adjusted based on what your income has been previously. So the Part B deductible also changes each year. We also find out what that's going to be usually in November. This year, it's $233. So you're responsible for the first $233 before even Medicare pays for Part B services. And you may pay a higher premium if you sign up after your initial enrollment period. So basically, if you did not have health insurance through a group employer, and you were eligible for Medicare because you were over 65 and you just never got around to signing up for it, if you do wait and sign up later on, they do have some penalties that they add on, which makes the premium go a little higher. The coverage is physicians who accept Medicare. And then, of course, some preventative health care is provided. So basically with Medicare, you can go anywhere in the country and see any doctor that you want to see if you're on original Medicare. And the question you ask is, do you take Medicare? That's how you can see anyone as far as that goes.
Gotcha. Two questions here, Jennifer. One, with original Medicare, if this is all that somebody has, theoretically, they could, have huge medical bills because you're paying 20% of all of the costs, basically. Yes. Right?
Yes.
In addition to the monthly premium that you pay for Part B, which, again, you said typically that number right now is how much?
$170.10 per month for 2022.
Okay, so you pay $170.10 a month for Part B, but then, with that, you also would be tasked with covering 20% of all of the bills that are covered as well. Okay, yes. Just wanted to make sure I understood that properly.
Yes.
We did have a question also through the Q&A box. 40 quarters. Yes, that is 10 working years. So to be eligible for Part A of Medicare, as long as you have 10 years or more of, time spent working and paying into Medicare, then you would be able to be eligible for Medicare.
Yes. And
And again, any other questions?
If you didn't work those quarters, but your spouse did, because sometimes stay-at-home parents may have not gotten the 40 quarters, they're eligible due to their spouse.
Awesome. Okay, perfect. Yeah, and please do keep using that Q&A box. That'll help to make things a bit more interactive today as well. So, all right.
So on original Medicare, what is not covered? So what is not covered that essentially you or your additional insurance is responsible for? They don't cover the deductibles, the co-insurance, and the premiums. You are responsible for paying Part B premiums. That Part B deductible that I said was $233 this year. That's your responsibility. And then the Part A. Part B excess charges, Medicare Part B excess charges, those are some charges that you can get through providers. Medicare doesn't pay those. You don't see those too often. I run into them occasionally, but that's not really a big concern that I've run across. Prescription drug coverage, you're responsible for that as far as paying for that. Additional benefits such as hearing, vision, and dental, that is not offered by original Medicare. So if you feel that that's something that you're going to need, you will want to either look into getting a plan that covers those things or purchasing standalone coverage for hearing, vision, and dental. And then long-term care or custodial care, if that's the only care you need, most nursing home care is considered custodial care. Do not rely on Medicare for long-term planning because they will not cover you as far as your stay in a facility. Your doctor visits in the facility might be billed through Medicare, but the actual stay, that's not Medicare. So long-term care is not covered. Part D, prescription drug plans. This part's easy to remember. D like drugs. So Part D coverage is something that you get on your own through a standalone prescription drug plan. Helps with the cost of prescription drugs. They're only offered through private insurance companies, and you have to continue to pay your Part B premiums in order to get a standalone drug plan. So with prescription drug plans, the coverage varies from plan to plan. You have some that are very robust and cover quite an extensive formulary of medications. Those cost a little bit more. You have some for people who are what's considered extremely healthy. They don't take any medications. They sit down, they say, I don't take anything. So those plans, they still have medicines that are covered in their formularies, but they're going to be less expensive. And so you want to evaluate the plan based on what you need, cost and coverage wise. Catastrophic coverage protects you from high drug costs, and the benefits can change from year to year. So every year on a drug plan, you will get an annual notice of change, end of September, beginning of October, tells you how that plan is going to change for January 1st. So the premium could stay the same. The premium could go up or down. I've seen them do both. But you do want to make sure that you pay attention if you're on a drug plan for that notice and not let it sneak up on you in January when all of a sudden your Social Security distribution is being deducted a much higher premium than what you were paying before because the plan's renewed at a higher amount, whatever. You can shop it every single year. So each plan has a list of drugs that it covers. That's the formulary. And that list does change. Sometimes medicines will be available for a longer period of time, and it changes the tier that they might be in. And a lower tier generally means lower cost to you, lower cost to the insurance company. Newer medications can sometimes start out as a higher tier. They may be more costly. So those medicines, those formularies, they can change from year to year. So you might want to check that if you're shopping a new plan. Anytime you shop a new plan, if you're on medication, you want to look at the formulary. The coverage is not automatic. This is something that you have to enroll in. So you need to get a standalone drug plan, because if you do not get one when you are initially eligible, and you're not covered by something that is considered a plan that's considered creditable by Medicare, basically a plan or drug coverage maybe offered through your employer or offered through your spouse's employer that is considered creditable by Medicare. That is where, if you decided not to have a drug plan because you were covered under that type of plan, that you wouldn't have a penalty. But if you weren't covered by another plan that's considered creditable, like GoodRx, that's a great little card you can pick up at the pharmacy, but that's not considered creditable coverage. So if you were to enroll later on, you would have a penalty if you didn't have it from your initial enrollment eligibility period.
Wow, that does not sound like fun. So even if I'm not on any prescriptions, when I go to enroll into Medicare, is it still a good idea to enroll into Part D and pay the premium for something that I might not even use?
So it's definitely a good idea because you don't know what the future is going to look like. And you could be 75 or 80, and now all of a sudden you've been prescribed 2, 3, 4, maybe 10 prescriptions, and you didn't have that when you were 65. And now you need a drug plan. Well, now your drug plan is going to have penalties, and those penalties don't last for a short or, for a specific amount of time. The penalties are there for the rest of the time that you are enrolled in the plan. So they factor in all the time that you didn't have it and add that penalty on. So if you are not taking any medications, my personal opinion is to look at some lower cost plans that are available in your county. See which one works for you. There's some that are really inexpensive. The deductible might kick in on a lower tier, which, that might get a little confusing. But if you're not taking any medications, I would just get an inexpensive plan. Look at a few different plans and get an inexpensive plan just to have it.
Perfect. All right.
So we talked about formularies. Prescription drug plans do have the formularies. It's a list covered by the plan. Many plans have tiered formularies. Lower the tier, the lower the cost. So your tier ones with the little $1 sign, that's your cheap generics. Those are not very expensive at all. And a lot of times a tier 1 medication could have a zero copay for you. Just depends. Tier 5 are the most expensive. Those are newer, more costly. It doesn't even have to be new, but a lot of times I'll see new medications that have been given that tier. But those are the more costly ones. Tier 1, 2, 3, a lot of people, most people, I would say their medications might fall into the 1, 2, 3. Occasionally you might see 4 and 5. It just depends on your own unique situation. So there's coverage stages with prescription drug coverage. It can be confusing if you're only on a couple of generic medications. You might not have to think about this. When you're getting into higher costs on your medications, that's where this may come up. As far as the coverage stages, the first thing that applies is the deductible, but not all plans have a deductible. Depends on which one you're on. Some of them only apply the deductibles to tiers 3, 4, and 5. So if you're taking 1 and 2, the deductible might not be a factor for you. It just depends on the individual plan that you're looking at. Initial coverage is spending up to $44.30 this year. This is the 2022 number. The $44.30 is kind of hard to track because that's the spending between you and the drug company, or not the drug company, the plan. So what the plan and you are spending for that medication counts towards this cost in the initial coverage of $44.30. And then if you've heard about the coverage gap or the donut hole, they're saying it's going away. Basically, once you've hit the $44.30, you're spending a little bit more towards your prescriptions until you and the plan are spending $7,050. That resets every year. Sometimes if you're on a really expensive medication, you could hit the donut hole very early. But once you and the plan have spent the $7,050, you've reached catastrophic. And once you've reached catastrophic, the cost generally goes down quite a bit, which you'll see on, I think, on the next slide. until the end of the year. And that does reset right there. Coverage cycle starts over on January 1st.
So we do have a question in the question box. Someone just wanted some clarification and saying if you, the encouragement or your personal opinion, Ms. Jennifer, was to at least enroll in Part D, even though you may not necessarily need that coverage early in retirement because it would entail penalties later on. Can you just make sure we got that clarification correct?
Yes. So when you initially have your initial enrollment period for where you signing up for Part B, and you've got, your A is in place, your B is in place, and some people don't realize that they need to get Part D. Some people know they should get Part D and don't get Part D because they're not taking any medications. My advice is to get Part D, because if you need it down the road and you don't have it, they will put a penalty on for every month that you didn't have it. So if 10 years goes by, you're looking at that number of months tacked on to your monthly premium for the drug plan you might get in the future, which we don't know what that's going to cost. But they average, they work up a penalty for it and then they tack it on later on. So my advice, if you're not taking any medications, is to still look at a drug plan, even an inexpensive one, even if you have no intention at all of ever using it because you haven't taken a prescription in 20 years. There are plans that are available if you're in this area. If you're in Hanover or Richmond or Chesterfield this year, you can get a plan that's like less than $10 a month, but you've met the requirement of having Part D coverage. So Medicare doesn't tell you you have to, they just penalize you for not.
So when we look at these formulary tiers here, can you get a plan that say only covers tier 1 drugs? And I would imagine that would be, a pretty inexpensive plan because anything that's tier 2 or above would be higher, or how does that work exactly? How do you get
the plans have formularies in them? So there aren't any, or I haven't seen any that say, well, we're just going to cover the tier 1s, or we're just going to cover tier 1 and 2. So they all have the medications, that cover different things. It might just be that your cost sharing is higher, or your deductible might kick in on a tier 2, which might take you by surprise. It's something that you would think is not that expensive. Oh, well, now you have that plan's deductible to meet. So it really just kind of depends on your own situation. But a lot of times, I meet so many people who are 65 years old and say, I don't take anything. Well, if you don't take anything, then there's 2 plans right now that one is less than $10 and one is right under $12. And I would say, look at one of those 2.
Just so you have it. You never know when something can happen also.
Exactly.
Even, when you're in your 20s, 30s, 40s, you might not take any prescriptions, but, something can happen and you might need some medicine at some point as well.
And how often can these things be changed?
Say it again.
How often can these coverages be changed?
Once a year.
Start with tier 1. Okay.
You can change it in the fall, which you'll see kind of towards the end. We'll show the enrollment periods, but you always have the chance to reevaluate. Let you get rolling. Yeah. You always have the chance to reevaluate. So cost sharing for Part D for 2022, the annual deductible is set by Medicare, so it can be up to $480 this year. It can be lower, it just can't be higher. So the annual deductible is up to $480. Not all plans have that. The initial coverage limit, which we went over on the previous one, $44.30. And when you're in the coverage gap or the donut hole, you're going to pay 25% of the cost of that medication till you and the plan reach that catastrophic coverage, $7,050 and above. The drug copays drop to generics, $3.95 or 5%, whichever is greater, and then brands $9.85 or 5%, whichever is greater. And this part can get confusing, and if you are confused by it, it's fine. You will figure it out. It's okay. It's okay. All right. So you've got.
So we do have
go ahead.
Sorry, I do have a question. I'm not sure if we've fully. I think we've gotten a little bit past it, but someone was saying they have Part A only because they're 65 and still working. Should she have gotten Part B at 65 anyways, or is that a preference thing?
So I think that's something that we're going to touch on in a couple slides down. But if you are still working and you are covered by your employer, my advice is to first, you need to make sure that the plan that you have is considered creditable by Medicare, which generally most employer plans are, not all, but most. But I would evaluate your cost sharing for that plan versus what you could get through Medicare. Because sometimes your employer might be paying for the whole plan, your entire premium. Sometimes you might have a spouse on there and they would lose coverage if you were to sign up for Medicare and come off of group. It's a few different factors to consider, but it's worth considering if you are working past the age of 65 to sit down and write down and look at, this is my cost, this is what I'm getting. This is my cost, this is what I'm getting. Because you are eligible at 65, even if you're still working to switch. All right, so the alternative, or not the alternative, but a coverage option once you're on Medicare. And you have seen this, if you have a TV or a radio or something, you have seen them advertise Medicare Advantage plans. So if you are eligible for Medicare, you have the option of taking your Part A coverage, your Part B coverage, and your Part D coverage. Some don't include it, a lot do. Rolling them all together into one plan, which is called Part C or Medicare Advantage. So with Medicare Advantage, you're combining those three. You are now covered by a private insurance company. These are the plans you see on TV because they often include additional benefits that are above and beyond original Medicare. We talked a little bit ago about vision, dental, and hearing not being covered by original Medicare. That is something that they will shout from the rooftops about a Medicare Advantage plan. They'll say, you need to get this extra stuff. Well, that's what they're offering. They're offering things that Medicare may not cover. And that's because it's covered by a private insurance company. And the eligibility for a Medicare Advantage plan is basically you have to have your Part A and B. You cannot have only one. You have to have both. And you have to live in the plan service area. That's it. That's the eligibility. So the plan premiums and benefits change from year to year, can change from year to year. Similar to where I said the prescription drug plan will come out with something in the end of September, beginning of October. That's what the Medicare Advantage plan is going to do. They're going to come out with an annual notice of change, and they're going to let you know, hey, maybe you have a $0 premium, but the cost sharing with going to see the specialist is a little bit different this year. Your copay, if you have to go in the hospital, is a little bit different this year. Could go up, it could go down. It's not necessarily always going to go up. So you want to look at how it's going to change each year, but you must continue to pay your Part B premium to stay on the plan. Many plans include prescription drug coverage, and then coverage can be limited to a service area unless it's an emergency. So with all of these plans, if you're traveling throughout the country and you have an emergency, the emergency is going to be covered. You are covered under an emergency situation. But if you're visiting someone and you think you want to go to the doctor under a non-emergency situation, you may not have that coverage with the plan, depending on the type of plan you have. It's not necessarily true for all of them. You may be required to use a network of doctors and hospitals. Again, that depends on your plan. And then, of course, may include additional benefits above original Medicare. I said dental, vision, and hearing before. There's other things that are available. That's just something you're going to hear on TV and news, but there are other things that those plans do. And the other things that those plans are doing is going to become more and more popular, and you will probably hear more things in the future, those benefits, because that's a great thing about having them. So the types of Part C plans, you've probably seen this before if you were covered by your employer. So if you're covered by your employer's insurance, or even if you had to go out and get insurance on the marketplace, you were probably looking at a health maintenance organization, an HMO, a preferred provider organization, a PPO. You may not be familiar with a special needs plan, but those plans are available through Medicare and a Medicare Advantage plan. And then an HMO point of service, health maintenance organization point of service plan. Those things, those are types of plans that are available. And then you have private fee for service and medical savings accounts. So you're not really going to see too many of those. I have seen some in the past where people are on them, but I would say the first three, the HMO, the PPO, and the SMP, that's where I see the majority of people who are getting onto a Medicare Advantage. They're picking between those three. So
if we could pause for just one or two questions. There was a question earlier about Part D, which I believe you may have somewhat addressed part of the answer through explaining Part C. But the question was pertaining to how do you, or where do you go to shop for Part D plans? Is it a website? Is it a phone number? Is it a local area that you go to? Are you able to answer that?
you call me.
There it is.
You call me, you call someone who you trust that will help you with your Medicare stuff. You can look on medicare.gov. I would not call a call center personally. You want to have someone who you trust that's going to say, okay, here's the pros, here's the cons, and look at a few different things. But you can always look at it on medicare.gov yourself, set up a profile on there and go through some of the plans. You can call me. This is what I do every day. You don't have to, working with me, working with an agent that you trust, you're not necessarily, you don't pay the agent. You should never be paying for it. You're basically talking to someone who is guiding you through the plans and helping you choose the right one for you. So whether it's me or whether it's someone else, you want to pick someone you trust to kind of help you look through them and decide.
That's a great answer. In fact, I think you have a new relationship brewing. She's very excited to connect with you. So just be prepared for that relationship.
Very good.
And the second question, I guess something I had is Part C. Is that something that if you sign up, you're pretty much stuck with throughout the remainder of your retirement? Okay.
No. So Part C, a Medicare Advantage plan, again, similar to the Part D or a prescription drug plan that's standalone. You can look at that throughout, like you can look at that every year. Occasionally, there are reasons why there will be an enrollment period that opens up. So there are some enrollment periods that are available right now to people who are on a Medicare Advantage plan. If they really don't like their plan and they want to switch, there could be an eligible enrollment period that's available to them. For the most part, you are looking at the annual enrollment period, which is October 15th to December 7th. So if you've been on a Medicare Advantage plan, you're not in your initial, which means you just turned 65 or you just left your works insurance after 65. You're out of that time period. And now you're looking at, oh, I've been on this for a couple of years and I don't like this about it. Talk to someone, talk to me, talk to someone else you trust, talk to someone, see what you can do. Sometimes can't do anything. We have to wait until the annual enrollment period. But as an example, like this year in this area, there's a Medicare Advantage plan that came up with 5 stars. So when a Medicare Advantage plan has 5 stars, which is a rating system that Medicare uses, you can look at it throughout the year. It's a possibility for you throughout the year. So you want to see if something could be available. If you move, you have a new eligibility period, things like that. There's certain things that come up. So it's always a good idea. Generally think of it as being October 15th to December 7th. But if something happens, it's good to talk to someone to see if there's something else that's out there. Okay, so we talked about Medicare Advantage plans and then the alternative to, I'll say alternative, but basically instead of being on a private insurance Advantage plan, Part A, Part B, Part D rolled into C, you can stay on original Medicare. We talked about that at the very beginning. Part A, hospital, Part B, medical. The coverage that you would want to have if you chose to stay on the federal program is a Medicare supplement. So with a Medicare supplement or Medicare supplement insurance, what you're looking at is getting coverage that helps you to cover the gaps that are in original Medicare. Okay, so these are sold by private insurance companies. The plans are named A, B, C, D, F, G. They've got a lot of letters. They're not all available in our area. For the most part in our area, you're going to see some people have F. If you talk to somebody who's on Medicare and you say, what do you have? Oh, I'm on original Medicare with a supplement. Which supplement do you have? Probably F, probably G, maybe N. Like, different people have a few different things, but that's what you're going to see for the most part. Massachusetts, Minnesota, and Wisconsin have different than the other states, and benefits can vary by plan and Medicare start date. Medicare start date, what that's referring to is that if you turned 65 after January 1st of 2020, you can no longer get an F plan. But if you were eligible for an F, because you were 65 prior, you can still look at F plans. So, but generally, if you're turning 65 now, F are no longer available. So that's why that's in there to mention that. But as far as
question there, Jennifer, if somebody turned 65 before that date of, I think you said January 1st, 2020, but they were on like a group insurance plan, but now are retiring, can they still shop the plan F as well?
Yes.
Okay.
They can shop and compare an F and see if that's the way they want to go. So that's
okay, good to know.
Available to them. And when I say help in the beginning, where I say helps cover the gaps in original, cover gaps in coverage from original Medicare. If you remember in the beginning, we talked about what the Part A deductible was if you had to go into the hospital. And we talked about Part B, and we talked about how you were responsible for 20% of the Part B approved charges. Basically, Medicare paid 80 and now you have to pay the 20. That is why people get supplements. Supplements pick up those, fill in the gaps, pick up where original Medicare leaves it as your responsibility. So Part A deductibles covered, Part B, it depends on the plan, but essentially you want that 20% taken care of for you.
Right. Awesome.
So for the eligibility, you must be enrolled in Medicare Parts A and B, and you have to be a resident of the state in which you're applying for coverage. And you have to be 65 to get a supplement, or under 65 in certain states. Now they changed this a little bit as far as here, if you're under 65, but it doesn't really make sense to get a supplement if you're under 65 and eligible for Medicare due to disability. There's some different factors that go along with it and some costs that make it doesn't make sense when you sit down. So in your mind, if you're thinking about a supplement, you have to be 65, minimum of age 65. Again, the costs helps with some of the out-of-pocket costs that are not paid by original Medicare. The premiums will vary based on the plan and the carrier. Generally, the best time to enroll is the 6-month open enrollment period following your 65th birthday or Part B effective date. I wouldn't say following, I would say you want to coordinate it with your Part B effective date. So like right now, I have people who are getting onto supplements that's going to be effective the same day their Part B is effective. And then there may be some other situations in which your acceptance is guaranteed. So when it says the best time, what that means is that if you're applying when you're turning 65, we're not asking you any health underwriting questions. You want a supplement, you will get a supplement. If you're coming off where it says other situations, if you're coming off of your employer's insurance and their insurance that you had the entire time with no gaps in coverage was considered creditable, then that would be a time where you could get a supplement because you came off of that employer's insurance. If you wait, if you're not in that initial eligibility period and you don't have other insurance and you say, hey, maybe now I should get a supplement, you may have to answer some health underwriting questions, which could not, depends, affect getting a supplement. So your plan choices. Step one is going to be, you're going to enroll in original Medicare. SSA.gov, if you have not set up your profile on there, you can go on to SSA.gov and elect your Medicare when you're turning 65, if you're ready to get onto it, Part A, Part B. And then step 2, you're going to decide if you need additional coverage, and you have 2 ways to get it, just like we talked about. So it's going to be, it's kind of like thinking of yourself as you're at a fork in the road and you're going to go left or you're going to go right, and you cannot do both. Option 1 is you're going to have Part A and Part B. And then option 1 is to add one or both of the following to original Medicare. So your supplement and your Part D prescription drugs, or the Medicare Advantage Part C. So you would do that because you want to have A and B together, get some additional benefits, and then also have your drug coverage included into that. When can you enroll? That's a good question. It's something that everybody should pay attention to. As far as you don't want to miss your eligibility period, you have the 3 months before, the month of, and the 3 months after your 65th birthday is your initial eligibility period, your IEP. This goes back to that question that we got earlier. What happens if you're working after the age of 65? So if you are working past age 65, you can enroll in A and B. You need to talk to it's recommended, I would say highly recommended, that you speak with your benefits administrator. Keep records of your health insurance coverage. You want to be able to show that you've been covered. If you elect not to enroll in Part B, you want to show that you've had coverage the entire time. Or if you have Part B and you're not getting a supplement because you're keeping your group's insurance, keep those records to show that you've been covered. There are instances where you may need to enroll in Part B and pay for Part B, even if you're covered by your group's insurance. The size of the group will usually determine that. And your benefits administrator should be able to help you and say, yes, we are a smaller group and you will need to have Part B. Because when Medicare is working with your employer's insurance, they have to coordinate. And sometimes Medicare is primary and sometimes the group would be primary. May not need Medicare, might need Medicare, just depends on your work situation. When you're retiring, you may be eligible for a special enrollment period that can allow you to enroll in original Medicare for up to 8 months after the month of your employment, or your employer's health insurance ends, whichever happens first. And you can enroll in a Medicare Advantage or prescription drug plan for up to 2 full months after the month your employment or employer health insurance ends, whichever is first. So that's an SEP for working after the age of 65 and being covered by your group's insurance. Here we go back to the size of the group. If you're working past the age of 65 and you are in a company with fewer than 20 employees, you will want to sign up for Medicare during your initial eligibility period, which is 3 months before, the month of, and 3 months after. And the reason that is because Medicare is primary when the group is under 20. But confirm that with your benefits administrator. Medicare supplement, open enrollment. So this period lasts for 6 months and begins on the first day of the month in which you're both 65 or older and enrolled in Medicare Part B. So you have up to 6 months after to be able to get on to a supplement in your open enrollment period. I would say coordinate it with your Part B effective date. So additional election periods, like we talked about earlier, the annual enrollment period is October 15th to December 7th, and that's for plans to begin January 1st. The open enrollment period, which just started in the last couple of years, that's January 1st to March 31st. You can change from one Medicare Advantage plan to another plan or back to original Medicare and a Part D plan. This is not the same as the annual enrollment period. Think of this as a correction, in that when January 1st rolled around, you were on the wrong plan for you. You either stayed on a plan that you didn't realize was not the best one for you, and didn't realize that the annual enrollment period ended, or you enrolled in one during the annual enrollment period, you started using it in January, and you then decided this is not the right plan for me. You have now an open enrollment period, or OEP, to make that one-time correction. After that, you've got some special enrollment periods. I think I touched on that a few slides ago. If you're moving into a new area, if your plan were to discontinue, if you're moving into a skilled nursing, or if your income status changes. Becoming eligible for Medicaid opens up enrollment periods for you.
So as we go on to come to, I'll say, a somewhat conclusion, I do want to pause for two additional questions, outstanding questions that were asked in the chat. First question, I'm going to read it verbatim. Generally speaking, is supplemental a lower cost than getting an Advantage plan, or do they do different things? That was the first question.
They do different things. So a supplement or Medigap, those two words are going to be used interchangeably. Now, some people will say, I want to supplement to my Medicare, and they're just saying in addition to, but they really mean just some other kind of insurance once you're on Medicare. But an actual Medicare supplement or Medigap plan is a specific plan that fills in the gaps that Medicare does not pay. They don't make coverage decisions. They are not deciding your network. If you sit down and you decide, I want a supplement through Mutual of Omaha, and your neighbor sits down and says, I want a supplement through AARP United Healthcare, neither one of those are going to approve or deny your knee surgery or say, we're only going to pay this or that. That is decided at the federal level because you're on original Medicare. If original Medicare approves it and covers it, the supplement pays their portion. So with an Advantage plan, it's different than a supplement. Because they are a private insurance company, and most everyone's familiar with that who's been covered by insurance their entire adult life. Private insurance companies are making those decisions for you right now. If you're covered by individual or group plan, they're deciding if you have an approved knee surgery. They're deciding how long you can stay or things like that. They're making those decisions. Supplements don't make those decisions. They're deciding if the doctor you want to see is in network. Supplement isn't going to say that. The question is going to be, when you're on a supplement, do you take Medicare? If they take Medicare, you can see them because you're going to give them your red, white, and blue Medicare card, and you're going to give them the supplement card. As far as costs go, you're looking at basically paying up front for a supplement. You're going to pay a premium every month. You can go to the hospital 1 week a month for the entire year, and you know what your costs are going to be. They're going to be that monthly premium. They're going to be possibly your Part B deductible. That's pretty much, you can plan that out. You can get the calculator out and figure out what that's going to be for you. You can go not at all. You can not go to the doctor for 1 solid year, and your supplement premium is still going to be the same. You may or may not use that Part B deductible. A Medicare Advantage plan is going to be pay as you go. So you might see $0 premiums. You might see lower premiums to get certain plans, just depends on what they are, but you are going to pay as you use them. You will pay a copay maybe to see a specialist. You'll pay a copay if you go into the hospital. So nothing's free. No, if anyone says free, they're lying. No, but nothing's ever free. You're going to pay up front, or you're going to pay as you go. And there's advantages and disadvantages to both sides of it. And once you figure out, okay, this is what this would look like for me, because honestly, and I will give an example of yesterday, I have a married couple, and one of them chose a Medicare supplement and a prescription drug plan, and the other one chose an Advantage plan, because they're in two very different circumstances as far as their health, their tolerance to risk, and they looked at the numbers and decided this was the way they wanted to go.
Man, that's awesome.
Wow.
Your new favorite client also wanted your professional and or personal opinion on Medicare Advantage plans. She was asking with dental and vision, or she said the part with Medicare Advantage plan from other insurance companies, what are your thoughts on those plans in terms of what they provide that are different, whether it's some that add or involve dental or vision or some that may not? Do you have a personal professional opinion on Medicare Advantage plans?
So there are some Medicare Advantage plans that are really great. They're really offering some nice stuff. It honestly just depends on you, on where you're at, what's coming up in your life, how your health's been, what you expect. Cost is a factor. Cost drives a lot of choices. Some people don't care. Money doesn't matter. So they're not worried about what premiums are. They just, they're like, I don't want to think about it. So it doesn't, if money's not a factor to you, you might make a different decision. As far as my opinion on Medicare Advantage plans, they're growing a lot. So they're growing across the country. More and more people are getting onto the plans. And as they're growing, they are offering they're becoming more comprehensive in what they're offering as far as benefits. Not to be plan specific or anything, but you might hear about grocery cards. You might hear about gym memberships. You might hear about, in addition to the vision and the dental and the hearing stuff, you might hear about transportation. That might not be something that you need, but there are people that I work with that some of those things they want. They're like, I want that. I want to get that. And they have no problem with it. So I would say at this point, in the beginning, when I started working in Medicare several years ago, more and more people were on supplements with drug plans. And now it's catching up to be more half and half.
And so just kind of for monthly premium costs, it could be pretty comparable. It's just a matter of which one, is kind of personal preference. So in terms of how you would rather have it with original Medicare and the supplement or the Advantage plan.
Yeah. So with monthly premiums, what you want to, if you're kind of like going to do, like you're going to write down, okay, this is what my cost would be on original Medicare with a supplement. And this is what I would spend on a Medicare Advantage. The Part B premium is there on both sides. You have to pay that whether you're on an Advantage plan or you're on a supplement. You're going to pay a monthly premium for that supplement. And that premium is going to go up each year as we age, as the plan, insurance companies raise their premiums. They pay more money. They end up making us pay more premiums. So those premiums do go up. You do pay for a drug plan on the original Medicare supplement and drug plan side. So those, that's a $170, $110 cost for the Part B if you're in the standard. And then whatever your cost is for a supplement, and then whatever your cost is for a Part D plan. On a Medicare Advantage side, you still have $170, $110 if you're in the standard bracket for income. And then we're going to get into like, okay, what do you see on TV? Oh, get a $0 plan. You're not paying, you're not sending you money every month to that plan. They are getting money from Medicare basically to cover you, to insure you, to keep you healthy. So if you're looking at what your out-of-pocket costs are going to be, you could look at a $0 plan, and that, you're not writing a check out or having money deducted every month for the plan premium or a drug plan premium. But you might have a copay if you go see the specialist. Well, sometimes that works out because somebody only sees a specialist 2 times a year. And so they sit down, look at those 2 numbers, look at what it would be on both sides, how much they would use it, they think, and make the decision for them.
Gotcha. Awesome. So I think we were at kind of the next steps area here. So walk us through this and then we'll just kind of wrap things up for today.
Yeah. So the next steps, you basically want to review your enrollment periods. Where are you at with the enrollment period? If you're not 65 yet, you're good because you're learning, and you'll know to pay attention when you're 65, what you need to do. Talk to your employer, stay on their insurance, get your Medicare stuff lined up. One of my biggest takeaways, I would say, is if you are still going to work and you still have the choice of their insurance, look at the cost, look at what you have deducted from your check, to have that insurance, and then your cost sharing when you're on it, and compare it to what you can do on Medicare. So review those enrollment periods, research your options. That ties into what I had just said. Sit down and look at what Medicare would look like, what Medicare with a supplement would look like, what an Advantage plan would look like for you. And you'll be able to make the decision that you are happy with. But I will say this, I don't have anyone living in my house who's 65 and my phone rings offering me Medicare Advantage. Don't talk about Medicare to people who call you on the phone. When they call you on the phone, it's usually from a specific carrier. They might not compare other carriers. When it says number 2, research your options across the board. Ask questions to people that you trust. I mean, you will hear a million opinions when it comes to Medicare. Talk to your parents, talk to your friends, talk to your neighbors. Everybody's got something to say, and it's always different. And then enroll. Make sure you enroll. If you're in your enrollment periods, you need to get those things in so you're not penalized. You just want to make sure you're doing it. And then have a yearly review. Review what you have, see if any changes need to be made. Sometimes you don't have to change anything at all, but you definitely want to review it each year.
Awesome. And so that's something, Jennifer, that you do with your clients. You help them to, walk through each of those 5 steps. You help them to research their options. You also help people, not just when they're right at 65, but when they're 70, 75, 80, to make sure that they're still on the right plan and any tweaks that may need to be made down the road as well, correct?
Yes. So
Okay.
That's what we do. We reach out. We say, if we can't get you by phone or email, we try to send you say, hey, do you like what you have? You don't feel pressured by the TV to make a change, but let's talk about what you have. You might not have to change anything, because if you're on a Medicare supplement and you say, wow, this is really going up, let's look and see what else is out there. I'm happy to look at whatever else is out there. But
Right.
Generally, think of changing supplements. You might have to go through underwriting, and that's something that you might have not factored in. So it's always good to talk about it. And it's always good to look at what else is available.
Perfect. Okay. And how can folks reach you?
How can folks reach me? So we'll put my information. You can reach me by phone or by email, and you have all my contact stuff, and I can send out my card.
We'll send that to everybody. Everybody who's attended today, we'll definitely send the contact information. Jennifer, can I read that off?
Yes. Yes.
Yeah.
So my email is
phone number. Okay, go ahead.
My email is really easy. It's just my name, Jennifer, JENNIFER @GHTinsurance.com. So that's my email.
GHT.
George Henry Thomas. GHT Insurance, all spelled out, .com. And then my phone number is 804-304-9446. And that's the most direct way to reach me. There is a main line for GHT, but if you call that line, the number I just gave you, the 804-304-9446. If I don't answer, I get that in a voicemail, and I always call everyone back. And I'm an independent broker,
Wonderful.
so I represent most of the carriers that are available in Virginia. I'm not licensed outside of the state of Virginia as far as Medicare stuff goes, but I'm happy to review and look at what you have, look at what's available to you. And you do not pay money to work with an insurance broker. They are paid by insurance companies. So just like your car insurance or your home insurance, when you're shopping that and looking at that and talking to an agent, they get paid by the insurance company. I'm the exact same.
Perfect. All right. So any other questions here before we wrap up? Well, Jennifer, thank you so much for your time today. We really appreciate all the insight, all the information. I know I personally learned a lot, and you and I always kind of joke. You say that I know all this stuff, but you've told me, probably 5 or 6 times now, and I still learn something each and every time. So I really appreciate it. And
Thank you.
Thank you for everything. Yeah. And
Yeah,
I'm sure that there will be some folks who follow up. Just as we always say, Marcus and I are always here to help you review your overall personal financial situation Jennifer is a great resource to help you review that information when it comes to Medicare, whether you're on there now or if you are leading up to it and looking to learn more before you turn age 65. She's a great resource to work with you one-on-one in a similar capacity to how Marcus and I work with you with regard to your investments and retirement planning. So we hope that you found some great information today. And thank you all for tuning in. Hope you have a great rest of your day.
Yeah. Thank